We're spending so much time inside. We have windows that block infrared light because we don't want to increase our cooling costs. We have replaced all of the lights in our homes with LED bulbs. What Bob Fosbury calls this is the scurvy of the 21st century. I know this sounds like wishful thinking, like you just need to get outside in the sun, but yet, what do we see on those British ships? Drink this ration of lime juice. Your sailors, your colleagues will stop dying. It's that simple. We have created an environment that is completely bereft of the same wavelength of light that the sun is giving us the majority of, and it is also very beneficial for just about every cell in our body. I believe that incandescent bulbs are better than just narrow band LED red light or infrared light therapy. LED lights are not as effective as diverse multi-wavelength light that we would see either from an incandescent bulb or from the sun itself. Much better results versus just one particular color of red light. 50 years ago, you would easily hear from the scientific community, the only real benefits for going outside in the sun is getting your vitamin D. That's the only thing that we knew. The sun is way more than just vitamin D.
Dr. Seheult, for somebody right now hasn't tuned into the importance of their light environment, let's give them the 101 on why this is something that is so critical and what it's doing to their health.
Yeah, very good point. I think the best way to start out is to look at the ultimate source of light in our world, which is the sun, and the three types of light that come from the sun and what they do to the body, because all three types of light are very important to the human body. The first one, we all know about this, and that's when we go outside and we say we're getting our vitamin D, and that's because ultraviolet, which is a form of light that we cannot see from the sun, it's so high in wavelength in frequency that it's beyond our ability to see it, but it's there. And it when it hits the skin, it takes cholesterol derivatives in our skin and turns it into vitamin D. So that's really important. Vitamin D has many attributes to it, not only bone, calcium metabolism, but also immunity, things of that nature. So that's one of the benefits of going out in the sun and having appropriate light. The other is visible light. So this is the light that you can see with the naked eye. Red, orange, yellow, green, blue, indigo, violet. We could get into a talk there about how certain colors actually affect our brain. Very good research going on right now at University of Arizona where that's being looked at. For instance, I'll give you an example, a green light and blue light. The colors of green and blue actually have an effect on our perception of pain. It actually reduces our perception of pain. Maybe the reason why we notice that people that get outside have less need for pain medications in the acute pain setting. They've actually done studies on this. But it's much more than just color. So light itself going into the eyes is one of the major zeitgebers or effectors of the clock that runs in your brain that runs all the systems. And this is, I can't really understate this. This is so really important for your entire body, how important this is. To give you an example, if you take Disneyland, for instance, you know that during the day, there are operations that are going on. There are rides that are going on, the gift shop, all this stuff. But at night, all of that shuts down. And there's literally an army of people, of employees that go in at night to get the park ready for the next day. Engineers that shut down the rides and check for fractures in the metal. The gift shop that gets restocked. The gardeners that weed the gardens. The people that take the gum off the pathways. And so when Disneyland opens at 8 o'clock in the morning, the whole crew that's worked on it the whole night, it's like a brand new park. And the human body is far more complicated than Disneyland. And as a result of that, you can imagine all the systems that are in place. There are systems that are functioning during the day that incorporate molecules to make things, food that you're eating. And then at night, the opposite happens. Things get broken down. Things are being repaired. And all of those genes are coordinated by your circadian rhythm. So what is the major input that determines that circadian rhythm and its effect? It's light. Light going into the eyes. There's also an effect of mood. So light coming into the eyes also affects mood, especially in the morning time. This is the reason why people, especially women who live at high latitudes, are susceptible to getting seasonal affective disorder, which is a condition where they're depressed, they're not seeing enough sunlight. This typically happens in the wintertime, hence the term seasonal affective disorder. So that's a whole talk right there. And then the last type of light that comes from the sun is actually the majority of the photons that come from the sun. More than 50% of those photons that come from the sun are in the infrared spectrum. This is very long wavelength, very easy to penetrate through things very easily. The atmosphere, your clothes, your skin. In fact, there was a recent study that was just published from London, University College London, Glenn Jeffries group, that they actually measured infrared rays going through someone's body and coming out the other side. And not only that, but that lab has also done great work in showing the effects of infrared light on the cells, specifically the mitochondria, the engines of your cells, and how it upregulates energy production, which is really the antithesis of what we see with aging. So, and this is infrared light, and there's multiple randomized controlled trials which now show that this type of light, infrared light, has a tremendous benefit on health, not only in the long-term setting, but also in the acute setting. There's a paper that was just published this year, or actually in 2025, that showed that medical intensive care and surgical intensive care patients, both that are exposed to this type of light, leave the intensive care unit 30% faster and are stronger than those that get placebo. So to review, we have ultraviolet light, vitamin D, very important there. We have visible light, super important in terms of our circadian health and mood. Can't understate that. Also, darkness is really important for circadian health. So having light at the right time of day and having darkness at the right time of day. And then finally, infrared light, which increasingly more and more we're becoming devoid of that in our environment, where we have LED lights in our homes. We have windows that block infrared light. We spend 93% of our time inside. So really, this is a huge topic. There's multiple effectors of light on the human body, and there's many places to dig in.
Well, that was a great overview. I think taking time now and getting into each of these more in depth is a good way to structure things. Coming back to UV, which is the first one you went over there, this is not visible. You mentioned the connection there to vitamin D. Let's talk about, in a practical sense, what it looks like getting the UV light in a healthy way.
Yeah, so you really have to be outside to get that, because ultraviolet light, even though it's very high frequency and high energy, it does not penetrate very well through objects, through clothes. So you have to be somewhat exposed. And because it cannot penetrate very easily, the sun has to be pretty high in the sky for you to get enough ultraviolet radiation. So wintertime is not a good time to get ultraviolet light. That's why a lot of people supplement with vitamin D. But there's actually more to ultraviolet light than just vitamin D. We did say vitamin D with ultraviolet light, but there's something called nitric oxide, which also is released from exposure to ultraviolet light. There was a study that was done, in fact, looking at blood pressure and latitude. This was prior to 1980, when we started developing very effective blood pressure medications. And this study was done looking at the entire globe and measuring people's blood pressure in various countries and measuring the distances from the equator. And what they saw was very clear. It was subtle, but it was very clear and statistically significant. The further someone lived from the equator, the higher their blood pressure was. And we've shown this. Richard Weller, he's a dermatologist at University of Edinburgh in Scotland. He was actually on this paper, and he was one of the first to show that ultraviolet light exposure to the skin creates a molecule called nitric oxide. And nitric oxide is a second messenger system effector in the cell, which basically means that it is telling the systems in your body, the vasculature in your body, to relax. And so when the blood vessels relax, when they open up, now the pipes are bigger and the pressure inside those pipes are relieved and the pressure comes down. Well, this type of light is more abundant at the equator, and there's about a 5 to 7 millimeter difference when you go from the equator to the highest latitudes in that study. So, and by the way, not only going north, but also going south away from the equator, they also noted the same thing. So vitamin D is a steroid hormone. That's important to understand, because steroid hormones circulate throughout the body and they're able to penetrate through the cell surface and actually go into the nucleus of the cell, where they are able to interact with transcription and DNA reading to make messenger RNAs. And messenger RNAs, of course, are what is the code for protein synthesis in your cells. So the reach here is very, very wide. What we see with ultraviolet light, multiple benefits. So how do you get this ultraviolet light? Well, you've got to be outside, and the sun has to be pretty high up in the sky. The darker your skin is, the more time outside you have to be to get this ultraviolet radiation, because the melanin, not the melatonin, but the melanin in your skin actually blocks ultraviolet light. So if you're very fair-skinned, and Fitzpatrick, in other words, there's different Fitzpatrick types of skin. One is the most whitest, and 6, I believe, is the most darkest. If you're one of those higher levels, you could get outside and get quickly your daily dose of ultraviolet radiation. If you're not, if your skin is darker in color, you've got to be out there for much longer. Think about this. I think we can all agree that the human race probably originated somewhere around Mesopotamia or Africa, somewhere close to the equator, and they were very likely dark-skinned people. As they moved away from the equator, think about what happened here in terms of adaptation. As these groups of people moved away from the equator and moved into Europe or even Northern Europe, the body's need for ultraviolet radiation was so constant, so powerful, that those societies actually became lighter skinned, because the availability of ultraviolet radiation at those latitudes was diminished enough that there had to be adaptations that the human race had to have in order to remain a viable race at those latitudes. In other words, their skin had to become more and more pale. If you think about it the other way, as you're going down to Australia, it's kind of an aberration there, is that there's quite a lot of ultraviolet light down in Australia, even though they are quite far away from the equator. And that has to do with the ozone layer and ozone blocking ultraviolet radiation. So there's a paucity or a lack of ozone around Australia, around the South Pole. And as a result of that, much more ultraviolet light comes in. Look at the people indigenous to Australia. Very far away from the equator, as opposed to Northern Europe. The Northern Europeans, very light-skinned traditionally. Who are the Aborigines of Australia? Still very dark-skinned, interestingly. And I think as a result of that, we can kind of conclude, maybe anthropologically, that Australia's always had quite a bit of ultraviolet light. Now what you do is you put people who are light-skinned in an area where there's a lot of ultraviolet light, and you're going to get a lot of burning of the skin. Conversely, you take people who are darker skinned and you put them away from the equator, where they already have a sort of a built-in mechanism to protect themselves from the abundance of ultraviolet radiation, which they're used to getting at the equator. And you put them in an environment where they're not getting enough ultraviolet light because they're not outside long enough. And now you introduce to them, the modernities of all of these technological advances, like being indoors, air conditioning. You can see very quickly how, and it's easy to understand why so many people at these latitudes can be very deficient in vitamin D.
Okay, you're making it very clear early on, which I think is critical, that when it comes to light, it's not just vitamin D. Because I think that can actually be a detriment to a lot of people who see it that way and figure, okay, this is getting complicated, different types of light, different, latitudes, skin colors. I'm just going to take vitamin D and be done with this. So you're making it clear, vitamin D, I know you're somebody that does take it. You feel it's important. It's a piece of this, but it's just a small piece of the whole picture here.
Vitamin D is necessary, but it's not sufficient. I think that sums up what we're talking about. And it's going to become even more clear when we start talking about infrared light, which is on the other extreme of that visible spectrum. Absolutely.
Okay, let's stick with UV right now. And I want to make sure before we leave this part, we're clear with people the goal here. Because again, with the variables, skin color, latitude, and even time of day is going to influence heavily the amount of UV. How does somebody know if they're getting enough? And let's start near the equator to eliminate that variable. And then I want to talk to the person like me. We were talking before the call. I'm in Ontario and we're in the middle of winter right now. What can I do by getting outside or hacking that to make sure I'm getting enough of this UV light?
Yeah, and UV is an interesting aspect because there are certainly beneficial effects to ultraviolet radiation, but there's also detrimental effects to ultraviolet radiation when used in the absence of the other types of light. So when used alone, we have evidence, at least on petri dishes and in labs, that ultraviolet radiation, because it is so high in energy, can actually cause mutations in the DNA, and that leads to cancers. So there's this concern about skin cancers. There's a concern about melanoma. Interestingly, there's a paper that just hit preprint, which is Richard Weller's paper looking at a UK biobank 400,000 large study where they looked at ultraviolet light and the differences, at least in England at that latitude, and what happened to people who had a lot of exposure to ultraviolet light and people who didn't have a lot of exposure. And basically what they found was that if everybody in the cohort, in the group that they studied, 400,000 UK biobank, if everybody had gotten the least amount of ultraviolet light in that cohort, okay, as opposed to being distributed, if everybody did exactly what everyone did to get the least amount of ultraviolet light, there would be about 30 or 40 less melanoma deaths over about 8 to 10 years, but there would be probably 2,000 or 3,000 more all-cause deaths, okay? On the other hand, if they were to have made everybody have the highest exposure of ultraviolet light in that cohort, then there would be about 30 or 40 less, more melanoma deaths and skin cancer deaths. But there would be up to 3,000 to 4,000 less all-cause mortality, so non-skin cancer deaths. And so there's kind of a trade-off. And so your question is how do you in Ontario get enough ultraviolet light, or anybody around the world get enough ultraviolet light, especially in the wintertime? Number one, I would highly recommend getting outside for as much as possible, and there'll be reasons why we talk about that later. But for ultraviolet purposes, even on days where the sun is not high enough to get ultraviolet light, let me tell you, there's a astrophysicist by the name of Bob Fosbury who believes that something called Rayleigh scattering, which is the reason why the sky is blue, because it takes that area of the spectrum and scatters it across the sky, across the canopy, that you can actually get the right amount of ultraviolet B radiation from the sky, even though the sun itself is not high enough. So there seems to be some evidence that you can get enough ultraviolet light even in the dead of winter by going outside if there is blue sky. Obviously, the clouds would block that. But if there's blue sky in the middle of the wintertime, getting outside. Now, of course, that ultraviolet's got to have to hit your skin somewhere. So if you're completely bundled up and only your face is showing, you're probably not going to get enough. Going back to that, I would say supplement. Now, the question is how much do you supplement? It's really difficult to tell because the amount of vitamin D that somebody needs to take in to get to a specific level is dependent on their age. It's dependent on their body mass index. The older you are, the more vitamin D you need. The larger you are, the more vitamin D that you need. And also there are other extenuating circumstances as well. For instance, there's some studies, at least in animals, that indicate that high intake of high fructose corn syrup can actually inactivate vitamin D, turn it into the 24-25 version of vitamin D as opposed to the 125, which is the active form. So all that to say is that if you are concerned about your vitamin D levels because either you have darker skin and you live at higher latitudes, I would highly recommend consider supplementing with vitamin D, but I would even more highly recommend that you get your levels tested and make sure that you're at the appropriate level once you get on a certain amount of vitamin D. There's some people that supplement with vitamin D in the wintertime only, and they don't do it in the summer because they're outside enough. I think that's a reasonable way of doing it. The other thing I would just mention before leaving vitamin D is that vitamin D is a fat-soluble vitamin, which means it's possible for you to collect enough vitamin D in the summertime and then have it stored, at least for some use, as you go into the wintertime and use your body's store. So it's not something that you need to take on a daily basis. In fact, some people administer vitamin D monthly because it is fat soluble. So anyway, those are some thoughts.
That's a point I wanted you to hit on there. The fact that the seasonality, especially in a place like Ontario, maybe that's just a normal response for the body to
Yeah.
get different amounts of vitamin D and different amounts of sun as inputs in different times of the year.
Yeah.
So you mentioned vitamin D supplementation being a little bit different depending on variables for each person. What's the goal level you like to see with your patients?
Yeah, that's a good question. So there's, first of all, let's talk about the units. Nanograms per deciliter, I believe, is the one that I use. It's sort of the lower one. It's the one that we use in the United States. There's the one in Europe, I think is milliliters. Sorry, millimoles. Anyway, the one that I use is the nanograms, and for that, generally speaking, you'll see on the lab results that come back that they like that to be above 20 or 30. And that's been validated for bone. And I think that's probably realistic. I personally like to see in myself and also my patients a higher level, and it's only because of what I saw during COVID, where we correlated very well with vitamin D levels less than 50. As vitamin D levels started to come down less than 50, that's when we started to see an increase in the incidence of COVID-19 infections. So I don't believe that there's been a value that's been validated against infections or acute chest infections. I know that Martineau did a meta-analysis that was published in the British Medical Journal a number of years ago that showed that supplementation with vitamin D actually reduced acute chest infections. I'm not sure if he actually came up with a level where that seemed to be validated, but the level that I aim for is about 50. I think that's a reasonable level. And so I take supplemental vitamin D. I take about 4,000 units internationally daily. That's enough for me in my body, at my latitude, and my skin color to keep my levels at about 50. But everybody's different, and there is no magic dose. And so I would highly recommend that people get their levels checked because it may be too low, or more rarely, it could also be too high. There are a few case reports of vitamin D toxicity, so it is possible. I would just be careful and get your levels checked.
A lot of times with vitamin D, you see K2 being part of that supplement as a package. Do you think that's critical?
There are some studies that seem to indicate that vitamin K2, now this is not to be confused with vitamin K, which is obviously involved in anticoagulation, and it's an antagonist to coumadin. So this is K2, it's a little different. That it prevents the deposition of calcium in the blood vessels. So yeah, I have no problem with people taking vitamin K2 with the D as well.
As of late, I've been hearing this talk when it comes to vitamin D that it's actually used in rat poison. And there's a group of people, it seems to be gaining momentum, that are saying vitamin D supplementation is toxic and to avoid it. Have you heard this?
Yeah, I mean, in France, back in the Vendée War of the 1790s, they used to drown people in water, and that's how they kill people. Does that mean that water is dangerous and we shouldn't drink it? I mean, yeah, the rat poison's got high levels of vitamin D on purpose so that it's toxic. But just about I can't think of a single substance that we take into our body that, if given at high doses, wouldn't also be just as lethal. So yeah, I don't think that taking appropriate doses of vitamin D is toxic or lethal in any way, because that same argument could be used for just about any other thing. I could give people too much water. In fact, a woman, I use the France thing a little bit kind of tongue in cheek, but there was a radio station that put on a promotion to see who could drink the most amount of water, and this poor lady did win, but she died because she dropped her sodium too low because she drank too much water. Her brain swelled and she seized and died. So something as nutritious as water can also be taken to an extreme.
Good point. Have you heard of these spurty lamps or other brands or similar lights that can be used indoors, especially somebody like me in the wintertime, to synthesize some of what we'd get from sunlight?
I think we're getting better and better at that. I really have this philosophical problem with medical reductionism, where we try to find something that's good. We try to distill it down to its functional parts, isolate it, concentrate it, and then give it. Because when we do that, we take it out of its environment that it was placed in, and there may be actual beneficial associations with other factors around it that we may not understand. The case in point of that is the studies where we looked at lung cancer patients who had diets that were high in vitamin A and vitamin E, those types of substances. And so what we did was we ran trials where we gave high doses of vitamin A, vitamin E, beta carotene to lung cancer patients. They had to stop that study early because they found that those substances in high doses given away from the environment that they were normally in actually caused worse deaths. And so this idea of medical reductionism, where we find the magic particle, package it, and then patent it, and then sell it, I think it's never as good as the original.
Earlier, you talked about cancer and how balance is key, not getting too much light, not enough.
Yeah.
Let's bring sunscreen in and talk about people using that. Is there a healthy way to use that? Are there healthy sunscreens? Yeah, your thoughts in that realm.
Yeah, so what is sunscreen doing? It's the purpose of most sunscreens, although there are some sunscreens out there that actually want to block infrared light. I have no idea why they would ever want to do that. But most sunscreens are there to block ultraviolet light. You can block ultraviolet light with clothes, generally speaking. One or even two layers of clothing is plenty to block ultraviolet light. What I think people want, though, is they apply this sunscreen because they want to get out in the sun without the benefit of, or without the detriment of having clothes on, because they want a suntan. They want to be tanned. So if you look at the way they test sunlight, so let's talk about efficacy of sunscreen or sunblock. It has to be constantly be reapplied. It has to be on. It cannot be washed off. And that is the only way you can reach some of these SPFs that are published on these sunscreens. There's a big scandal going on right now in Australia because of the amount of melanoma cases. The government has actually kind of opened up and asked for products to be made so that people can get these sunscreen products. And what they found is that many of these products that are coming to market are not standing up to not even a tenth of what is published on the bottles. So the other effect of sunscreen is this psychological problem where you are psychologically think that you're protected. So you put the sunscreen on, you've applied it, you haven't reapplied it, you didn't apply it properly, and now because you think that you're protected, you're going to spend more time out in the sun, and actually you might even lead to more skin damage. The other effect of this is the chemicals that they put in the thing. Have we actually tested these chemicals and how they get uptaken into the body, what their effect is on the body in the long term? We don't know a lot of these things because we haven't looked for these things, but we know that chemicals can be absorbed through the skin. That's why we make medicines that are patches, right? Lidocaine patches, fentanyl patches. We know that the skin absorbs chemicals, and certainly that's no different with sunscreen. So I think if you're trying to protect yourself from excessive ultraviolet radiation from the sun, which I think is perfectly appropriate, especially in people who live in environments where there's a lot of ultraviolet light and they have sensitive skin, then probably one of the most effective ways of doing that is to cover up and to wear a broad-rimmed hat, to wear a long-sleeve shirt, to go outside but not necessarily in direct sunlight, or to avoid direct sunlight between the hours of 10 o'clock a.m. and 2 o'clock p.m. or even 4 o'clock p.m., and then go out in the morning when the sun is coming up, which has a lot of other benefits, which we'll talk about, or when the sun is setting. When the sun is at the rising aspect of the day and the setting aspect of the day, because it has to go through so much atmosphere to get to your eyes and to your body, there's really a minimal amount of ultraviolet radiation occurring at that time of day.
One thing you've hit on a couple times I want to highlight is with UV light, it doesn't go through the clothing versus what we're going to get into later with infrared, where we can still get our dose being clothed outside.
Yeah.
Before we part ways on the UV part, just to round everything off here, again, coming back to me in Ontario in the winter, we know it has to hit the skin to get the UV benefit. What is my best bet obviously exposing as much skin as possible, being out midday. But for me to get, as a Caucasian, light skin, what would I need to do throughout the winter to get a healthy dose of UV?
So some people would say that right now in Ontario in the wintertime, the sun is not high enough to produce vitamin D in your body. And I would say that that's probably true based on the height of the sun. Again, there is some disagreement in the scientific literature that you may be getting enough vitamin D through ultraviolet radiation through Rayleigh scattering from the sky. But let me just sort of reflect back. There was a study that was done, I believe it was Richard Weller again on this study, looking at COVID-19 mortality. And they specifically looked in the portion of the United States in the wintertime that was above, let's say, Tennessee, roughly speaking, where there was no way you could get enough ultraviolet radiation, similar to Ontario, where you could not get enough ultraviolet radiation to make vitamin D. Even in those, at that time, and even in those places, they were able to statistically show that the more sunlight that people had, the lower the COVID-19 deaths were. And this is in a paper that was published not only looking at the United States, but they validated it in Great Britain, and they also validated it in Italy, where in the wintertime, not enough vitamin D being produced, they thought, but still a benefit from a correlation with more sunlight. So to get back to your question, there's actually nomograms that have been published that show, like, if this is the time of year and this is your latitude, this is how much time you need to spend outside in the sun to get enough vitamin D in your system. And I don't have that in front of me at the moment. I can look it up. It's been a while since that's been published. But I remember looking at it and seeing that the longest amount of time that it took, it generally was around 5 to 15 to 20 minutes to about 30 minutes, generally speaking. But obviously in the wintertime in Ontario, in Canada, you're going to be 30 minutes plus to get enough of that light if you're going to get enough vitamin D.
And we also want to always come back to the thesis here where vitamin D is important, could potentially be a proxy for other things, but we know with UV specifically, there is NO, and there's probably a lot of things in our lifetime we won't even discover that UV is doing to the body.
Yeah, exactly. So that's, I mean, if we were to go 50 years ago, you would easily hear from the scientific community, oh, the only real benefits for going outside in the sun is getting your vitamin D. And that's because that's the only thing that we knew. We don't know what you don't know. And what we've discovered, especially in the last year or two, the science on this has really exploded. And we're finding out that the sun is way more than just vitamin D.
All right, let's pivot into visible light now. First thing in the morning, we'll go right through the day. When and what is the ideal exposure and why?
We're talking about visible light now. And because we're talking about visible light, we're talking about light's interaction with photoreceptors in the back of your eye. Now, these receptors are called intrinsically photosensitive retinal ganglion cells. So if we ever use that term, you'll know what they're talking about. These are not the rods and the cones that let you see specifically. These are general like light sensors, kind of like very similar to the sensor that you might have on an outdoor light that you have it set to come on when the sun goes down. That's the type of light sensor that we're talking about. So is there light? Is there not light? And that sort of thing. Now, these sensors tend to be on the lower portion of your retina. And as a result of that, they're more stimulated by light in the upper visual aspect of your visual system. And that's simply because the image gets flipped. So if you have an image in the upper portion, like the sun, where the sun is, where the sky is, that is going to project to the lower portion of your retina, which is where these retinal ganglion cells are. Now, these retinal ganglion cells have two projections. One projects to the timekeeper of your brain and of your body called the suprachiasmatic nucleus. And the other projection is to an area called the perihabenular nucleus in the brain. And this is where mood is regulated. So the two major consequences of getting outside and getting light into your eyes is not only getting your circadian rhythm all matched up, but also getting the appropriate mood. Now, this is really important to understand because this affects so many things in your body. So let's talk first about the circadian rhythm. Getting outside into bright light is going to keep your circadian rhythm on a clock and making sure that your schedule is on time. So many studies have shown that when people's sleep schedules change or they're not grounded at the particular time of the day, that's what increases cardiovascular risk. That's what increases cancer risk. And the reason for that is because you're not coordinating the different aspects of your body all at the same time. Think about the Disneyland thing again, right? If you've got the engineers out there shutting down the ride, but you don't have the other people to inspect the ride, if they're not coming in at the same time, you're not going to get the full benefit of that team showing up to look at those, to look at Space Mountain, for instance. If you're not getting the guy who washes the street at the same time as the guy who scrapes the gum off the ground, and if they're not coming at the same time because they're not coordinated, you're not going to get the maximum benefit of those two groups of things that are probably regulated by different genes coming on at the same time. So what in fact you get is you get a half job getting done when your clock is not in sync. And so as a result of that, it's not too hard to understand why cancer rates would go up, cardiovascular rates are going up. The reason is because to keep your cardiovascular disease rates low, to keep your cancer rates low, multiple systems in your body need to be working in concert with each other to do the job correctly. And when the clock is not being set appropriately, those things are not being coordinated, and so you're not going to get the same kind of job. So one of the things that really entrains your clock to make sure that it's on time and everything's running on at the same time is bright light in the morning. And I would say before 9 o'clock. How do you get that bright light? You need to go outside. I can't say this enough. If you think that you're getting light enough inside your home, let me disabuse you of that understanding, because if you were to measure the amount of light in a typical room inside your home in the morning, you would hit maybe about 100 lux. A lux is how we measure the intensity of light. At the same time, if you were to go outside, it would be, if the sun was shining, it could be up to 100,000 lux. So you're getting 1,000 times more light outside than you're getting inside. And because of that, the dose needed is going to come 1,000 times faster outside than it would be if you're inside. Anybody who is in photography would understand this. If you set up a manual SLR camera inside to take a photograph, and you set the f-stop and the ISO and the aperture rating, all those things just for the perfect picture, and then take that camera, don't change anything, and go outside and try to take a picture, it's just going to be a big white blob. It's just going to be a white picture. And the reason is because there's so much more light outside than there is inside. The reason why it doesn't seem that way to us is because when we go outside, our pupils, because of our iris, get so much smaller, and they let in so much less light so we can adjust to it. You know this, right? When you're outside for a while and you come inside, everything looks dark and you have to let your eyes kind of open up and allow that light to come in. There's a huge difference between the light inside and outside, that if you want to get the benefits of all of your systems coming on online, okay? Again, think about it like you're flying and you have a connecting flight. If those time schedules are all off, you're going to miss your flight, and you're not going to get the appropriate thing done. It's the same thing in your body. All of these systems need to come on. They need to be regulated. Your clock needs to be synchronized. And the thing that synchronizes your clock is bright light in the morning before 9 o'clock. I would say 10 to 15 minutes is probably enough. It's probably more than enough. Here's the problem. This time of year in Ontario, you are getting up before the sun is getting up. Yeah, I mean, the sun may not even get up till, I don't know, what is it, 8? What is it over there?
I would say, yeah, around 8 o'clock.
Yeah, that's really hard to do, especially in the wintertime. And this is the reason why this is part of the reason why people in the wintertime are more susceptible to diseases. It's the reason why we see the highest levels of mortality across the board. It's also because of the lack of sunlight. So what we found, and it's the main reason, the point being here, it's the main reason why we see people with seasonal affective disorder. So this is the other pathway, not just it projecting to the suprachiasmatic nucleus, which is the time clock of the brain, but it's also projecting to the perihabenular nucleus, which regulates mood. And typically it's women, but also men in the wintertime, January, February, this is where they're depressed. They're not getting enough light. And here's the typical thing that happens. And I know this is in Toronto. I know this because I grew up in Toronto and I visited several times. You can literally, in the wintertime, you know this better than I do, but for those that are listening, you can literally go in your apartment in North York. You can go down to the basement level of your apartment. You can get a path that leads directly, without even going outside, to the train, to the subway station. Take the subway station down to the closest terminal downtown, get on the path and walk through basically, miles and miles of mall-like underground, come to where your high-rise office is, and then take an elevator up and stay in your office. And you can literally do this every single day and never go outside. It's an amazing infrastructure that you guys have in Toronto. I don't know of many other cities that have that. It's quite a testament to the engineering that you've got there and the fact that you don't have earthquakes, which is really, you just had an earthquake, which is about a 4, but that's another topic. Here's the point, is that you're not getting exposed to light at all. For those of us in California, it's not much different. We don't have that underground infrastructure, but it's not a dissimilar story. You get up in the morning, you got to get in for a 7 o'clock shift. You go to your garage where your car is parked. You drive in the dark to your underground parking structure, and you go into your building, and then the sun comes up. And then you're working there till 5. The sun's already down, and you're driving home. Again, no benefit of seeing any kind of light. So that type of day in, day out for weeks in the wintertime is going to wreak havoc on your circadian rhythm, not even to mention the fact that you're going home and as late at night, it's dark, it's supposed to be dark, but you're watching screens, you have the TV on, you're socializing. It's just a disaster. So here's what we know works for that type of thing, okay? We know this works. Buying what they call an SAD light or a SAD light, it's about 10,000 lux. You turn it on and you sit in front of it for about 20 minutes because what you really need is about 3,000 lux hours. So think about that. 10,000 lux for 20 minutes, which is a third of an hour, right? So 10,000 times a third is about 3,333 lux hours, okay? Remember that number. This is about 11 to 16 inches in front of your face. When people do that, they are simulating the visible portion of the sunlight, and they're getting the benefits as if they were looking at the sun when the sun is not up. So it helps with circadian rhythm. It helps with mood. We have studies on that. You can go to Amazon and buy these SAD lamps, 10,000 lux, sit in front of it for 20 minutes. Now, imagine, Jesse, if you go outside and you're going out into the sunlight and it's 100,000 lux. If you just need 3,000 lux hours and this thing is 100,000 lux, you need a 30th of an hour. What's a 30th of an hour? It's literally 2 minutes. 2 minutes outside in the bright sunlight, not looking at the sun, looking directly below it or somewhere on the horizon below, because remember, your intrinsically photosensitive retinal ganglion cells are in the lower portion of the retina. So you want this light to be up in the superior visual fields. That comes in, you literally only need to be outside in bright sun for 2 minutes to get the same benefit that you sitting in front of a 10,000 lux lamp, you need to be there for 20 minutes. Does that make sense?
It does, yeah. So it sounds like in my position, the only thing in the winter to do is get one of these lamps.
Yeah, I think it would have helped tremendously. Not only do we see that it reduces the depression, but there's also some evidence that if you were to put something called a dawn simulation lamp. Have you heard of a dawn simulation lamp?
No.
Okay, so these are lamps that you can buy. You put them in your room and you set them to come on at a certain time of day and in the morning, so like 5, 6 o'clock, as if it's simulating the sunrise. And what it does is it glows brighter and brighter and brighter as you're asleep, as your eyes are closed. This light will then simulate you as if you were sleeping outside. And it's been actually shown to improve cognition, to improve the quality of sleep, and a whole bunch of other endpoints in terms of health. That this is actually what I have in our bedroom.
I have actually heard, now that you explain.
Yeah.
If you're doing that, just to be clear, I assume you'd still want to use the sad light afterwards.
I would definitely recommend the sad light if you feel like you have, or you've been diagnosed with seasonal affective disorder. Absolutely. I believe that it probably has other health benefits. And here's the other health benefits. We talked about the clock. So I want to talk about cortisol a little bit, and I want to make sure that I explain this well. Prior to you getting up and getting outside and doing stuff, your body needs a chemical called cortisol. Cortisol is also a steroid hormone. It would actually look very similar to vitamin D, okay, because it actually has very similar effects on transcription in the nucleus. And then there's another hormone at the end of the day, which we're familiar with, called melatonin. Okay, melatonin is a hormone that is also secreted from the pineal gland of the brain, and it comes on right before sleep. So here's this dichotomy that I want you to be very, very cognizant of. Cortisol needs to spike before you get up and go, and basically as you're getting up in the morning and you're ready to do work. Okay, because it's getting the body ready to do work. And melatonin is the spike that happens right before you go in for bed. And what you really want to have is high amplitudes of a spike. So here's the thing that we notice that happens at the beginning of the day with cortisol. When you get up, if you stay in a very dark environment and don't get outside, you will have a slight increase in cortisol. But because the amount of cortisol is tightly regulated, you still need to have the same amount of cortisol. It's just going to happen over a much longer period of time. So instead of a very sharp peak that goes up very high, sharply comes back down, and you get all of your required amount of cortisol at one time, and then it stays low for the rest of the day, which is the ideal. What happens is you get this slow, lethargic, anemic growth in cortisol, but it has to stay high because it needs to give you the dose that you need for that day. And so it continues on and actually may even interfere with melatonin production later on that night when you're trying to go to bed. So here's the issue that many people have, Jesse. They say, I can't sleep. I can't fall asleep. And by the way, this long lethargic rise, lipidic rise of cortisol that occurs gives you the right dose, but it's this chronic elevation of cortisol that can lead to so many metabolic problems. What you want to have, what everybody should have, if they want to have good sleep at night, is a very high peaking cortisol where all of the cortisol that you need for the day is given right at the beginning. It comes down and it stays quiet for the rest of the day. That is the optimal amount of cortisol that you should get. There is one thing that will do that better than anything else, Jesse, and that is exposure to bright light in the morning.
And to round that out, we're going to get to darkness and making sure we have that covered as well.
Yes.
But at night, we want to make sure we're in pitch dark.
Yep.
To help with the melatonin on the other end of what you just talked about.
Absolutely. Yeah. So you'll notice that the keys to good health is doing the right thing at the right time. We have very good evidence that exercise is good for you, but we also have very good evidence that rest is good for you, right? So how could that be that these two opposites are both good for us? How is it possible that eating food is good for us, but at the same time, fasting is also good for us, right? Again, these two things that are completely the opposite of each other, yet they're both good for us. And I think the key here is understanding that there is a time for things and there's a time not to do things. And what we're trying to say here with light is there's a time to go out and get as much light as possible into your eyes, and that's in the morning time before 9 o'clock. And then there's a time that you want to make sure that you're not exposed to bright light at all. And that is at night, as you've just mentioned. So there's a time for light, there's a time for darkness, there's a time for eating, there's a time for fasting, etc.
So far, when we talked about UV, we were focused on light on the skin. Now with visible, we're focused on light in the eyes.
Yes.
Let's expand out and talk about visible light on the skin. And I want to take our time here and get into the benefits of light on the skin, if there are any. And then if there's any detriment at night, if we're, say, wearing those blue light blocking glasses, protecting the eyes, but still getting dirty light, we'll call it, on the skin.
Yeah, so this is not a black and white issue. There's not a heavy demarcation here. And I'll say that when we look at visible light on the skin, which is what you brought up, this benefit of infrared light, which we haven't gotten to yet, does bleed a little bit into the visible spectrum, because there's a number of studies that show that red light itself, which is of course visible, can actually have a benefit. But the benefits are probably tied in with a lot of what we're about to say. And when we get to infrared light, which is a topic that I just love to talk about. So in terms of visible light on the skin, there are some studies, most of them are in the red light. When we talk about blue blocking glasses, again, the reason why we even talk about blue blocking glasses is because the blue blockers are obviously blocking blue light, and it's those intrinsically sensitive, photosensitive retinal ganglion cells that are exquisitely sensitive to that blue light. But let's face it, Jesse, they're sensitive to just about any type of light. And so really the best thing at night is to have no light. The second best thing is to have no blue light. And the worst thing is to have all types of light. So blue blockers have their role. I would say, just go for the gusto and eliminate all the light altogether.
Okay. Do we know a lot about the sensors, if there are even sensors in the skin, when it comes to activating in a good way and then protecting those at night so we don't get light on the skin, if that's going to affect melatonin?
Here's the problem that it would have to be very close to the surface. And that's because of this thing that we talk about, which is the depth of penetration. So if you look at the simple physics of light, shorter wavelengths like ultraviolet light cannot penetrate very easily at all. This is the reason why it has a hard time getting through clothes. This is the reason why when it hits your skin, it can get down maybe into the dermis at most. And that's really where these cholesterol derivatives are turned into vitamin D. But beyond that, as we start to get into the visible spectrum, yes, it can penetrate a little bit deeper, but not much deeper. Once you start getting down into muscle and into bone and the internal organs, the only type of light that's going to get down that far in the body is well into the infrared spectrum.
Okay. The reason I bring this up, I believe there's one study, it may be really old, where they shone light on the back of the knee, I believe, and how that affected either melatonin or sleep. I'm getting out of my wheelhouse here, but basically I've also heard people talk about blue blockers not being enough at night, and we need to be covering up our skin as well to block the bad light.
That's very possible. That's an area that I think may need more research. I certainly need to look into that more. I do believe that we really need to be in a very dark environment when we're sleeping. And this can be a problem for people who are sleep shift workers, or night shift workers, I should say, because the rooms really need to be blacked out. And it may not be enough just to have eye patches that you wear at night.
Let's stick with the night shift workers. Talk about what happens to their physiology, even if they are doing what you just said, making sure they're conscious of blocking the bad light when they're sleeping.
Yeah.
Is there any hope for them?
If someone is dedicated to that night shift, the best thing that they can do is to really just make the flip and be a nocturnal creature every day of the week. Most people who are night shift workers who do 12 on, 12 off are only really required to work about 3 days a week, 3 to 4 days a week tops. And the question really becomes, what do they do on the other days of the week that they're not working? Are they diurnal creatures that get up and are awake during the day? If that's the case, then they're working at night when their circadian rhythm believes that they should be asleep. Okay, and that's really where the harms come in with night shift workers. Most people, in my experience, are those type of people. They are day people, but 3 days a week they work at night. Okay, now that's as opposed to people who are true night shift people. When I say that, that means that even on the days that they are not working, they still get up at night and they still sleep during the day. If those people probably, if they do that correctly, and when I say correctly, I mean they're eating during the nighttime. They're treating their night as day and their day as night every single day of the week. They probably don't experience the same metabolic issues that we know occur in most night shift workers, which is increased diabetes, increased cancer risk, all of these things, obesity, etc. The reason why I believe that happens is because their circadian rhythm is still firmly anchored as a day shift worker, and they're just working these late nights. So there's a recent study, I will add though, there was a recent study that was done where they took people who were working day shift, they converted them into night shift workers, and then they did a randomized controlled trial, which was very interesting. What they found was in this very short-term trial, they were able to find markers metabolically that were surrogates for end-stage diseases like diabetes, hypertension, obesity, etc. And I don't recall what the names of those biomarkers are, but you could look it up if you get the study. What they did in the study was something very interesting. They simply randomized these groups of people to either eating at night or whenever they wanted to, and those people that were only allowed to eat during the day when they were sleeping. So how did they eat? They would eat and then sleep for about 3 or 4 hours, and then eat and then sleep for about 3 or 4 hours, and then eat, etc. In other words, the key is that when they went into work at night, they did not consume any calories. Okay? What they found in that study, very interestingly, is that intervention group that did not eat any food while they were working at night, they were able to reduce these surrogate markers of these bad diseases by about 80 to 90%. Fascinating. I'm a night shift worker. I occasionally have to do night shifts in the intensive care unit. I am certainly not a creature whose circadian rhythm is at night. I am firmly in the day. So when I do these things, I have to be, so as a result of that, I have adopted this practice, even though we need to do more studies on this, of not eating anything while I do that night shift work and only eating during the day, to try to mitigate some of these factors that are involved with night shift work.
We talked about blue light blockers. I want to make sure we cover sunglasses because we've talked about different benefits in the morning specifically, getting visible light in the eyes. Just like we talked about sunblock before, we could think of glasses as a sunblock for the eyes.
Yeah.
Obviously, something we want to be aware of if we're trying to get this light in our eyes in the morning.
Yeah, so it's a little tricky. If you've got reading glasses, no problem. The benefits of, not reading glasses, just regular glasses to be able to see. I would not recommend taking those off if you're walking around outside. We want people to be able to see. So contacts, I would also put into that category. However, if you're putting on sunglasses for that purpose, realize that you're diminishing the very reason why I was recommending that you go outside in the first place. And that's because the amount of light outside is so much brighter. Why would you want to diminish that with a tinted glass that's going to diminish that or change the spectrum that I believe was perfectly designed for the effects that it gets when you go outside? So I would not recommend sunglasses. Now, I say that with the proviso that there are many people that have eye problems, have retina problems. They're being followed by retina specialists or ophthalmologists. And if they've got a recommendation because they have a particular medical problem to wear those glasses, then I certainly don't want to interfere with that recommendation from their specialist. But in people who don't have issues with their eyes, if you want to get the benefit of circadian rhythm, the benefit of mood, you really want to go outside and not really have anything in between the sun and your eyes. Again, not recommending that you look directly at the sun. I think that's something that we can all agree that we shouldn't do. In fact, if anything, you want to look well below the sun to allow that light to get into the inferior retina at the back of your eye. So definitely recommend that.
What do you think about these more mild blue light blockers? They're yellow or a slight tint people are wearing them when they're on their computers during the day. Any value there?
I haven't seen data. I know that there's been some data looking at night shifts. They call the night shift where they switch the hue of the screen. And from my understanding and the data that I've seen on that, and correct me if there's a new study, it really didn't have the effect that they were looking for.
How do you feel about red light panels? You brought up red light before. And we can also expand out to lasers using light as a therapeutic tool.
That's a discussion I think that's going to be better had once we talk about infrared light. And there's some exciting work that is now going into exactly how does infrared and red, which are both long wavelength energies, how are they actually affecting the mitochondria? And what is actually going on there? There's new data coming out, and actually I've collaborated with Glenn Jeffrey, Bob Fosbury, and Scott Zimmerman, who have published on this before, and we should have a paper coming out very shortly. But the short answer to your question is I think the data is showing that monochromatic light. What do I mean by monochromatic light? I'm talking about lasers. I'm talking about LED lights are not as effective at doing the job that we want them to do as is diverse multi-wavelength type of light that we would see either from an incandescent bulb or from the sun itself.
Okay. We'll come back to that in a little bit then. I want to stick where we're at for now. People that are indoors trying to get good light, whether it be on the skin or into the eyes, but they're doing it through windows. Is there any benefit there?
It depends on the window. So there's always going to be some degrading of the wavelength. Again, we already talked about ultraviolet light. Really cannot penetrate through any kind of window very well. It's going to be eliminated because, I mean, there are certain materials. We actually talked to someone who found a material that has a lot of transparency to ultraviolet light because they're interested in getting that benefit. But for the most part, the commercial types of window materials that we have in homes tends to block ultraviolet light. Now, variably, it can block infrared light, and we'll talk about the benefits of that, but you really want to get outside and not behind a glass.
You quickly touched on incandescent light. Let's talk about lighting throughout a home. Given where modern technology is, the LED lights are being pushed upon us. What do you do for yourself?
I think the addition of an incandescent bulb in a room full of LEDs is actually beneficial. We actually have some data on that. Glenn Jeffrey just published a paper in Nature Scientific Reports showing that visual discrimination of color, which was an endpoint of mitochondrial function in the retina, was improved over 20% with the simple addition of a 60-watt incandescent light bulb in an LED environment. I think that's a tremendous. And by the way, that's one of the reasons why, that data is one of the reasons why I believe that incandescent bulbs are better than just narrow band LED red light or infrared light therapy, because Glenn Jeffrey repeated the work that he did on LEDs in that type of an environment and only noticed in some bands about 15 to 16% improvement. When he used incandescent, there was a global improvement of more than 20%. So we're seeing much better results, much more robust results with a broad spectrum, a broad biological swath of infrared frequencies versus just one particular color of red light.
One challenge is that these are being banned and they're harder and harder to find.
Yeah.
Due to their energy demand.
Yeah.
Do you see a day where we won't be able to get them?
Well, I think the days are here, and it's getting worse. In fact, in the United States, for instance, in 2028, there's a new rule that's coming out of the Department of Energy that's going to raise the requirement on these. So just to give you a little bit of a background, the way that we measure light coming from a bulb is something called the lumen. The lumen is very highly dependent on the green-yellow aspect wavelengths of the light, which is right in the middle of the visible spectrum, okay? So it's very concentrated in the middle of the visible spectrum. What that means is that if your bulb that you're manufacturing is using energy to produce anything outside of that very narrow spectrum, it's going to basically drop the efficiency of your bulb. So before we had any efficiencies, for instance, an incandescent bulb, that was about 15 lumens per watt. So in other words, for every watt of energy, every watt of power, I should say, that you're consuming, you should be producing about 15 lumens when you're talking about an incandescent bulb. A lot of energy is, quote, wasted outside of the lumen area. So, red, purple, infrared, that sort of thing. So back in, I think it was 2022, this law finally came in and they started making standards. They raised that to 45. So it went from 15 to 45. And what that essentially did, well, actually, there was no standard before. It's just that incandescent bulbs were 15. So they came in with the standard that said, okay, the standard is now, boom, 45. Effectively, all general service lamps that had anything less than 45 lumens per watt are now outlawed. You can't sell them unless they are for specialty items. For instance, they don't create an LED bulb for your microwave because it would just fry the components in your LED bulb, right? So you have to have an incandescent bulb there. There's also specialty lamps that require specific bulbs. Those are going to be incandescent bulbs. But we're talking about for your general lamps that you put in your homes, screw-in bulbs in your ceilings, all of those things. And some states have really even taken this off even higher, right? So like in California, you cannot build a home and have permitting unless on the plans it's written to put in an LED socket. And this is not a screw-in, right? So they don't say, there's no more screw-ins. You've got to have an LED fixture that can only be replaced with an LED fixture, not an incandescent bulb. So they've pushed it so much so that it's really inconvenient to have any kind of incandescent bulbs anywhere. So the point is that it was at 45. Well, with this new legislation that I talked about that's coming in 2028, we actually talk about it on our MedCram channel. They're going to raise this to 125 lumens per watt. Depending on the bulb that we're talking about, but generally around 125. That's going to completely decimate the production of any bulbs that are LED that give off here and there in the infrared spectrum. You just can't do it. And so that's where we're headed with bulbs and windows right now. This is the reason why I believe that we're essentially creating an environment that we're in 93% of the time that is devoid of infrared light. And as we'll talk about, that's pretty amazing in a bad way because infrared light is so beneficial. We haven't talked about it yet, but it's the missing link that we haven't talked about.
Well, it's interesting, as you say, 93%. I know the number of people with metabolic dysfunction is right around that same number these days, which is extremely high and sad.
Yeah, and that's the reason why I believe that infrared light is so much more. It's part of that equation when I say that sunlight is so much more than vitamin D. Infrared light resides in a lot of that space.
So given what you just said about the bulbs, it sounds like it's time to go out and stock up while we can.
If you can, yeah.
Okay, we're going to move to infrared light soon, but I want to make sure we cover one area in this realm first, being end of the day and when it gets dark. We did talk about the blue light blocking glasses and how they're an in-between. Best is not to have any of the bad light at all. But let's take me through an evening at your house. You just finished dinner. Given what you know about light, what are you doing throughout the house leading up to bedtime to protect against blue light and other harmful light?
Turning off lights. So really, the distinction between blue light and red light is really not that big. Really, if you want to do anything that's effective, you just got to turn off the light. So as I said, because these intrinsically photosensitive retinal ganglion cells are in the inferior portion of your eyelid, you really want to turn off primarily overhead lights. Those are the biggest offenders. And if you have to have lights on, if you have to, better to have lights on that are low. Okay. And generally, if you want to have them a little bit more red, that's great. Made me think about, how we grew up as a human race 200 years ago. What was the type of light that we were exposed to in the evening time? Imagine we're outside, we've just done our hunting gathering, if you like, and we're sitting around what at night?
Campfire.
Exactly. And where is that light? It's low down. It's radiant. It's pretty dim, generally speaking, and it's a red shifted. It's not blue shifted. So it's just interesting to me how everything that we used to do is so conducive to just a better experience in terms of our health. So we came out of that environment. We're now inside. We have lights that are overhead to illuminate what we're doing. It's like we're turning night into day, essentially, and putting our faces in front of screens. Look, I do it as well. As a physician, I have duties that I have to do. So, maybe my house is not the best example of what you need to do, but I'm working on it, just like everybody else is. We live in a system that requires a lot of inertia to change and to really get out of that system. There has to be a lot of change in our own lives to really get out of the system that we're in.
As you talk about our ancestors being outside around a campfire, it gets me thinking about light being reflected off the moon and light coming from stars.
Yeah.
Just interesting. I don't know if you've heard about any benefits to getting light in that realm.
Yeah, and the light from the moon, of course, is much dimmer, but there is infrared light there too. We'll talk about infrared light as well. We'll talk about it when we get into infrared light, but there are some definite benefits. And it's interesting that the moon cycles, right? So there's a full moon at certain times of the month, and then there's a dark moon. Who knows whether or not that cycling actually has some beneficial effects on the human body as well. I don't think it's been studied, or at least I haven't seen any data yet.
All right, well, the wait is over. Let's move into infrared light.
Okay.
Give us the 101, what it is and why it's important.
We have known for a long time that there are seasonal aspects of death. We see much more deaths in the summertime, in the wintertime than we do in the summertime. There's a number of data that came out of COVID that showed that even in the wintertime, the sun has benefits. So for a while, it sort of burned within me to look for the other aspects of sunlight that had nothing to do with vitamin D. So sure enough, an area of study called photobiomodulation was looking into light therapy for things. And this research has been going on for decades, but it's really picked up in the last few years. And what they have basically shown is that infrared light, which is light that has a longer wavelength than visible light, cannot be seen. You can feel it as heat, but it's not heat by itself. It actually is electromagnetic radiation. The majority of the photons from the sun are actually in the infrared spectrum. That this type of light, as opposed to ultraviolet light, is very easily able to penetrate not only through the atmosphere, but also your clothes. In fact, they've done research for some types of clothing. It takes about 10 to 13 layers of clothing to fully stop this type of light. So it can go right through your clothes without a problem. It can go right through your skin and actually come out the other side. Obviously not as strong because much of it gets absorbed in the body. There's a paper that I would highly recommend reading, two papers. One of them is called Melatonin, the Optics of the Human Body. That's by Russell Ryder and Scott Zimmerman. And another paper that was put out last year by Glenn Jeffrey and Robert Fosbury, who looked at a similar situation and was published in Nature Scientific Reports looking at longer, the title of that is Longer Wavelengths. And it talks about how longer wavelengths pass through the human body and actually can have systemic effects on a particular part of the cell. So let's back up here again. The sun. The sun has something called a photosphere around it. It's like an atmosphere, and it selectively allows infrared photons to come through easier, more easily. So that means that a sun that is the size and the temperature that it's at, specifically in our solar system, our sun is designed in a way that allows more infrared photons than would normally be expected. Okay, and that's really interesting. That radiation comes 93 million miles and comes to our Earth's atmosphere. And there are transparency windows in our atmosphere that allow certain types of light in much better than others. And that's because of the molecules that are in our atmosphere. You've got nitrogen, you've got oxygen, and that wiggling of those bonds absorb specific wavelengths of infrared light. Well, there are these windows of transparency that astrophysicists are well aware of, because if they want to see through our atmosphere, if they have an observatory high up on a mountain, they've got to look through a window of wavelengths through there so that there isn't any kind of interference with the atmosphere. Well, as it turns out, there's a number of windows in the infrared spectrum that allows this sunlight through their photosphere, and it penetrates easily through our own atmosphere. And it's this very precisely this type of light, this infrared light, that can go into our skin and can get down to a fair enough distance that it actually can have effectual changes. Where? At the mitochondria. Now, let's put that aside. If we were to look at many of the chronic diseases that we see going on in the United States, whether it's diabetes, obesity, congestive heart failure, dementia, COVID, long COVID, cancer, inflammation in general, at the epicenter of many of these chronic diseases is the mitochondria. In fact, the central theory of aging, Jesse, is this idea that as we get older, the energy output from our mitochondria, our batteries of our cells, start to drop off incrementally. In fact, some studies show up to 60 to 70% of the energy output in our mitochondria drops after the age of 40, after a number of years. So what we're seeing here is that there is a type of light, precisely this type of light that comes from the sun more than we should expect. We have an atmosphere that is perfectly set up to allow this very type of radiation through the atmosphere very easily. And we have our bodies in a way that allows this light to come in and interact at the mitochondrial level to increase, to improve, to enhance the amount of ATP and energy production in those mitochondria in just about all of the cells in the body that have mitochondria. And what we're seeing is not only changes epidemiologically, longevity, people who are out in the sunlight longer, but that has confounders with exercise. We are now seeing randomized, placebo-controlled sham studies that show that precisely this type of light from the sun in the infrared spectrum is reducing the length of stay of COVID patients in the hospital, is reducing the amount of glucose in the blood in patients who are healthy and are given a glucose tolerance test, are reducing the length of stay in ICUs by 30%, and they're coming out more actually stronger and less need of physical therapy. And the list goes on and on, the number of randomized controlled trials that show that sunlight, and specifically infrared light, is having this effect at the mitochondrial level in humans that are healthy and humans that have diabetes and chronic disease.
Okay, that's a great overview. As you're sharing that, it gets me thinking about infrared saunas.
Yes.
Is there any connection there between what's going on with a far infrared sauna and this light?
Yes, this brings up a very interesting point that we need to make sure that everyone's very clear about. The type of light, of infrared light that we're getting from the sun is multiple wavelengths over a large period. So we're talking 760 nanometers all the way up to 1200 or even beyond, even into long wavelength, okay? The same thing from an incandescent light bulb. We're getting infrared light from about 760 way out in an incandescent light bulb. That's different fundamentally than us going into a infrared sauna or having a laser focused on us, because that's monochromatic light. That's infrared light at one particular wavelength. Do you understand what I'm saying?
I do.
Yeah, so these are very different things. Now, in both of these situations, we are seeing improvements in health outcomes. I don't want to come across as saying that one does all of the heavy lifting and the other one does nothing, because we have data in both groups that shows that a broad infrared light exposure does benefits, and monochromatic laser, one particular wavelength, also has benefits. However, what I am trying to say is that we are noticing that the benefits are more pronounced in the broader sense when a broad source of infrared light is going into the patient, as opposed to just one. And again, the data that I cite for that is Glenn Jeffrey's work. He's done work in the eye, which has the highest concentration of mitochondria in the retina. And again, the endpoint there was how well are the mitochondria in the cones producing energy to allow the patient, the subject, to differentiate between two color groups. When he used monochromatic light, he got about 15 to maybe 15% improvement, and not in every single cone. When he used an incandescent light bulb, every single type of color blindness improved. And it was not just 15%, it was north of 20%, 25%. So when you ask the question to me, what do I think about infrared saunas? I would say that the infrared sauna is a way of delivering infrared light, like we see in many of these studies where there is benefits. What I don't know is whether or not infrared saunas are superior to somebody just making more time outside in the sun.
Okay, good answer. Important we went there.
Yeah.
We'll put the sauna aside for now, at least then. We know now this infrared light can go through the clothes. It goes right through the body. You've highlighted a couple times now mitochondria. Let's take it to the mitochondria.
Yeah.
And explain what happens when this light interacts with them.
Well, this is really where it's coming down to. So there is some work that seems to indicate that there's a couple of electron transport proteins in the mitochondria that can respond and upregulate their use when they have infrared light shone on them. Let me just back up here for those that are not biochemists or chemists or people who don't understand how this works. I want you to picture the three different types of food that we consume: fats, proteins, carbohydrates. All of them are broken down into a final common molecule called acetyl-CoA. Okay, acetyl-CoA is a 2-carbon molecule that goes into it's in the matrix of the mitochondria, and it undergoes something called Krebs cycle. And what we're trying to do here is we're trying to extract high energy electrons off of this molecule so we can run the body. Okay, so again, whether you eat fats, proteins, or carbohydrates, all of that gets broken down into a molecule called acetyl-CoA or acetyl-CoA that has high energy electrons. Now, it goes in the matrix of the mitochondria. We're extracting these high energy electrons in the form of NADH and FADH2, if you want to be technical about it. These molecules, these NADH and FADH2, go to the electron transport chain. Okay, now what I want you to picture is I want you to picture the Colorado River. Okay, it starts off in Colorado and it goes through the western United States. And as it drops down, as it's on its route toward the sea, which is in Baja California, it will reach these lakes. And we've built in the United States these massive dams that basically collect the water and run turbines as we let it go down below. I think the analogy would be the well and locks there in Niagara Falls, right? So you've got Lake Erie, which dumps into Lake Ontario, and it goes through the well and locks, and it goes down. But you also have a big hydroelectric, probably one of the first and biggest hydroelectric power plants in the world was built right there in Niagara, where water at 200 feet above Lake Ontario is directed and is turning turbines and generating electricity. So I want you to imagine these high energy electrons that are at a high level, and what the mitochondria is doing is it's allowing these electrons to transfer down the energy gradient. And as it's doing that, as instead of turning turbines, what it's doing is it's pumping protons out into this reservoir around the mitochondria. Okay, so as you're eating food and it's being broken down and you're getting high energy electrons from the food, what the mitochondria is essentially doing is it's taking all of that, all the diverse foods that you eat, and it's saying, the final common pathway of all of this is going to be pushing protons into this reservoir on the outside of this mitochondria. Okay, because later what happens is these protons start to come back in through a pump, and this pump then creates ATP, and that's how you get energy. Okay, but let's focus on how they're pumping these protons out. As these electrons are going down the chain, as we're going down the Colorado River, as we're hitting, the different dams, Hoover Dam, and et cetera, all the way down to finally it drains out into the Gulf of Mexico. As this water is going down its gradient, instead of turning turbines, what we're doing is we're exchanging electrons. So we're moving electrons down to pump protons through. Okay. Here's where I believe we are now coming around to this thinking, and expect a paper on this coming up shortly to talk about the details. When water goes down its gradient, there's like a waterfall, okay? That's an electron transfer. If you want to talk about it biochemically, imagine a protein, and you're transferring electron from one area to another area, okay? When there's actually equations that you can figure out that'll show you what the change in energy is when you do that. And if those of you who are following and are biochemists, that's a negative delta G, which means it's a spontaneous reaction. Here's the issue though, okay? Here's the issue is when that electron goes from one area to the other, you can imagine now that the area that it left is now positively charged, and the area that it's going to is now negatively charged, correct?
Yes.
Okay. When that happens, because this is happening in water, and water is polar, there's going to be a change in the orientation of those water molecules, right? The water molecules that were over here before that were around the neutral protein are now going to be flipped around in a way because they have to buffer this positive charge. Does that make sense?
Yeah.
And similarly, the opposite for the negative charge. So in other words, there's an energy of reorganization that occurs. So that's not captured in the equation of the free energy. There is a barrier to that electron moving there, and that barrier is not just the free energy. There's an activation energy that occurs, and there's a reorganization energy. This gets into quantum mechanics. It gets into Marcus energy. Rudolf Marcus, who's actually still alive, he's 102 years old, living in Pasadena. He won the Nobel Prize in Chemistry in 1992 for his work in 1988 on exactly what I'm talking about here. And what he showed was that basically there's a reorganization energy that occurs when electrons go from here to here. It's not just the change in the electron state, it's the change in the actual shape of the protein, it's the change in the solvents around the protein, and that is a barrier to those electrons moving. So here's what I believe infrared light does. I believe that infrared light in many different wavelengths, okay, it changes it makes it easier for the water to restructure itself in a way because it's introducing low energy vibrational energy. So it's basically greasing the skids to allow this conformation change to happen more frequently, to allow it to happen more easily, and to allow the restructuring of the solvents to allow that electron to move more easily. So when you have that type of energy entering into all of your cells, in the sunlight, and you have that ability to restructure the solvents, quote unquote, the reorganization energy, which is labeled lambda when you're talking about Marcus theory. The electrons, instead of having to go over activation energies to go down their concentration gradient and to go out, instead of that happening more slowly, now it's almost like a slide. Okay, the electrons can go down the electron transport chain much more easily. You have a much better pushing out of those protons into the inner membrane space. And of course, because of that, those protons are going to come back into the matrix and you're going to make a lot more ATP. And that's exactly what we are seeing in these experiments, Jesse. In Glenn Jeffrey's work, he gave normal subjects glucose and he had them drink this glucose. And he was able to measure in those that were not exposed to long wavelength light, the glucose spike went up a certain amount. And in those people who he gave this long wavelength energy to, which presumably was improving the organization energy, was allowing these electrons to fall faster, was pumping out more protons, there was more energy being produced at this time. And there was a over 20% reduction in the spike of glucose when these subjects to the glucose tolerance test. Now, he believes that this was because of mitochondrial metabolism, because in those subjects, there was not only a reduction in glucose, but there was an increase in the production of exhaled carbon dioxide, which we know is a product of mitochondrial aerobic metabolism.
Fascinating stuff. Wow, a lot we can get into here.
Yeah.
Where my mind goes initially, what does dosage look like? For somebody that wants to see this benefit, is it getting a daily exposure? Or is it getting multiple exposures a day? And then also talk about different times of the day and then how much of this IR light is available.
What's really interesting about this is that Glenn Jeffrey has looked at bees, he's looked at insects, he's looked at humans, and he tells me, he's like, look, Roger, it's the same every time. It's like a switch. You get about 15 to 20 minutes of this infrared light, and that's enough to get the system going. And further stimulation really has diminishing marginal utility. So he's done these experiments, as I mentioned, in various different species. When we look at the randomized controlled trial data, when we look at the Brazilian study in COVID, that was done in 2023. When we look at the MICU, SICU study that used infrared light in Brazil in 60 patients that was just published last year, how long did they give them infrared light to get the effect that they saw, which was dramatic? 15 minutes a day. 15 minutes a day. And we're not talking about a large amount of light. You know, a lot of us will believe that if a little is good, a lot is better, right? So if we were to look at the amount of infrared light in total that's coming from the sun and hitting us after it gets through to the atmosphere, you know, at the surface of the Earth, you're talking about 100 milliwatts per square centimeter. Okay? The energy that was given in these randomized controlled trials that showed tremendous benefit was 2.9 milliwatts per square centimeter. Not very high. You don't need a lot to get the benefits. And this is the reason why people are saying, you know, when we decry the fact that incandescent bulbs, say, why do we need to go to incandescent bulbs? You need to go outside. Incandescent bulbs only give a fraction of the energy that's coming from the sun. Guess what? You only need a fraction of the energy. We're finding out that the amount of infrared light that is necessary is actually diminishingly small. 2.9 milliwatts was the energy that was used in the Brazilian study that showed that these patients with COVID left the hospital 4 days faster. 12 days in the control group, 8 days in the intervention group. And that intervention group, by the way, started off sicker than the control group. Fascinating. Look, Tamiflu was FDA approved because it reduced flu symptoms for 24 hours. It stopped flu symptoms 24 hours earlier than the control group. We're talking about an intervention here that reduces 4 days off of hospitalization, 2.9 milliwatts per square centimeter. It's incredible. And the thing that I'm thinking about is that we're spending so much time inside. We have windows that on purpose block infrared light because we don't want to increase our cooling costs. We have replaced all of the lights in our homes with LED bulbs because we want to reduce energy costs. Essentially, what Bob Fosbury calls this is the scurvy of the 21st century. 300 years ago, British sailors needed food on their ships. And the way that they preserved the food, unfortunately, leached out all of the vitamin C out of their food. And so there was this issue with scurvy on British sailing ships because they were living in an environment that was perfectly designed to get the results that it did. And I know this sounds like wishful thinking, like it sounds like it's almost woo-woo, right? Here I'm saying that you just need to get outside in the sun, but yet what do we see on those British ships? Drink this ration of lime juice, and your gums will stop bleeding. Your sailors, your colleagues will stop dying. It's that simple. I also believe that we have created for ourselves an environment that is completely bereft of precisely the same wavelength of light that the sun is actually giving us the majority of. And it is also very beneficial for just about every single cell in our body.
Good news in all this. The infrared light, as we've talked about, does penetrate clothing. You gave that example before of that, say, business person in Toronto not going outside all day. But we're only talking about like 15 minutes here being outside per day, and you can be clothed. So it seems like to me, for most people, they would almost have to try not to get that, even in the winter. If you're shoveling your driveway, if you're walking your kids to the bus, to me, it seems like most people should already be hitting this metric.
Yeah. So you're living in Ontario and you're saying, Dr. Seheult, you live in sunny Southern California. Easy for you to say. First of all, I grew up in Toronto, so I know exactly what you're talking about. Here's the good news. The good news is that you don't need a lot of infrared light. Look, what is everyone concerned about in Toronto when you have a lot of snow and you get a few days of sunlight and some of that snow melts and then it freezes at night because it's really cold? What is everyone concerned about the next day?
The roads.
Exactly. We're concerned about black ice. Why are you concerned about black ice? Let me prove it to you. It's the infrared light from the sun, even when the sun is low enough in the sky, that's actually melting the snow. Okay? The snow is highly absorbent of infrared light. So when that infrared light comes and hits the snow, it starts to melt. And at night, it refreezes. Do me a favor. You've got plenty of snow to try this out on. When you see the sun out today, hitting the snow in Toronto, you will start to see that it's dripping. It's dripping. And note the temperature. Okay, the temperature may be above freezing. It may be below freezing. It really doesn't matter. It's the warmth of that infrared light that is penetrating the atmosphere, even in Toronto, and it is melting the snow. Notice the moment the sun goes down and sets, even though the temperature has not changed, the snow will stop melting immediately. And you will no longer see any more drips. It stops. And that is because the thing that is melting the snow is the infrared light that we're talking about now. It is precisely the very same light that is available even in the dead of winter when the sun comes up, even in Toronto.
When you were talking there a few minutes back, you mentioned incandescent bulbs, and you hinted at the fact that the benefit we're talking about here with the mitochondria could be gotten through that medium as well. Talk about the difference there of an incandescent bulb, the spectrum versus the sun, and your thoughts on getting this 15, 20 minutes a day by using those bulbs in the house.
Yeah. So this gets into a little bit of physics and what we call black body radiation. So any physicist will know that, well, let me back up a little bit. So somebody who doesn't know about physics and may approach this from a amateur level will say, look at the lumens that's coming out of a incandescent bulb. and look at the lumens that are coming out of the sun. The sun is so many times more bright than the bulb is. Here's the problem. When you look at the distribution of black body radiation and the equation that goes with that, it's actually to the temperature to the fourth power in the visible spectrum. But when you look at the type of light that we're talking about, which is the infrared, it's actually linear. And if you were to, I could show you this graph. If you were to look at a graph and see the amount of infrared light that comes out of a light bulb and that comes out of the sun, it's actually much closer to each other than you would expect, given the fact that the sun is many times more brighter than the bulb. What I'm saying here is that it would be a false assumption to believe that the proportion of infrared light coming from the sun versus the light bulb is proportional to the infrared light and the brightness. Do you understand what I'm saying?
I do.
The infrared light coming from a bulb, because of the distribution of the physics, is actually much higher than you would think for a bulb, given its brightness compared to the sun. So that's the theory. What about the practicality? Again, Glenn Jeffrey's work, University College London, took a group of people working in a university building there on campus that had windows that blocked infrared light, that had desks that were lit by LED bulbs that were not in the infrared spectrum, obviously, because they're commercial LED bulbs. And he took pictures in the infrared spectrum to show that the room was just basically black. There was no infrared light whatsoever. And he, at certain areas, in certain portions of the building, at people's desks, he set up a 60-watt bulb. Some they didn't, some they did, okay? They did visual checks. Again, he's in the Department of Ophthalmology. That's how he measures the output of mitochondria. The retina is the tissue in the body with the highest concentration of mitochondria. So he noticed that those people that had 60-watt light bulbs, we're not talking huge amounts, 60 watt at the desk, greater than 25% improvement in color blindness in those people's eyes compared to those people that were working in just an LED environment. He's working right now on a preprint. Jesse, in the next 6 months, there's going to be a number of papers that are coming out. I'm just letting you know. There's a paper. He could not do this study in human beings. It would be unethical. He did this study in mice. Unfortunately, that's the only one that you could ethically do it in, where he gave high doses of LED light and found that basically there was increased organ dysfunction in those mice that got the LED blue type of light. So, the incandescent light bulb, number one, is very similar to the solar spectrum. I'm not saying that the only solution is an incandescent bulb. We can make LED bulbs that have filaments and also other aspects in them that can fill out that infrared spectrum. We can design bulbs that do that mimic the sun even better than incandescents do. The problem is that they will never be able to get past the 125 lumens per watt rule that is coming in to the rule here in the United States in 2028. That's why I and a number of my colleagues have signed a petition asking the Department of Energy in the United States, I would hope they might do this in Canada as well, and also in Europe, to allow another category of bulbs that would not be regulated by general service lamp regulation. We could call it a wellness lamp regulation that would allow these bulbs to be produced and purchased for those people who chose to have LED bulbs that gave off in the infrared spectrum. This would be a choice. You should be able to do that. So we've already signed a petition. It's available out there. We actually did a video of it on our MedCram channel called LED 2028, and there's a link to the petition there as well. If it's still open, I'll have to check and see. But this is an area that we are raising awareness in because it's going to get worse if we don't do something about it.
Earlier, when we were talking about visible light, I brought up the red light panels. You quickly touched on them, but mentioned they'd probably fit better in this part of the conversation.
Yeah.
Given where we're at now, bring those in.
So many of the red light panels that are for market is almost, it truly does have an effect, but it's also a gimmick because underneath that red light are other wavelengths typically that are infrared light, right? But you can imagine the issues around a device that only gave off invisible infrared light. Like the subjects wouldn't feel like they were getting any benefit because they couldn't see them on, right? So the red light is put into that. I don't want to poo-poo the red light because, again, Glenn Jeffrey's group came up with a study where they actually shined 670 nanometers, which is red light, on these subjects. It's long wavelength light, but it's red light, and they had lower glucose and they had higher CO2 levels. So I would simply put that discussion of red light into the discussion of infrared light because I believe that area of wavelength from about 670 to 760 on to 1200 and further, they all have a similar benefit in that I believe what's going on there, and I think we'll be able to put a paper out that specifies this with a little bit more clarity. I believe what's going on there is that multi-phase, multi-wavelength light, including the red light, is helping restructure the attributes of the reorganization energy around these electron transfers to allow these electron transfers to happen more quickly with less delay, and that is amping up the amount of energy that the mitochondria is making.
All right, as you talk about IR light, it's obvious how excited you are about this aspect and bringing light, no pun intended, to the population as a whole on it. Anything else other than you've gone deep into the mitochondrial benefit? When it comes to IR light, any other benefits you think are important to highlight?
Well, I've spent so much time researching that aspect. Could there be other benefits of infrared light? Look, nothing surprises me anymore. There are things that we had no idea would have a benefit for, and the body has a way of harvesting this energy. Again, step back and think about this. And maybe I didn't make myself clear. The reorganization energy in our bodies that typically we have to overcome in human tissue, if we were to put it in terms of electron volts, is about 0.7 electron volts. Okay? One of the windows in the atmosphere that allow light in, there's a window right about 0.7 electron volts. Okay? That photosphere that I said went around the sun and sort of was a pass filter that allowed infrared light to come through better. That pass filter, which is basically a hydride atmosphere, allows photons with energies at 0.7 electron volts or less to pass through that photosphere. So we have three coincidences. We have a photosphere on the sun, which allows photons less than 0.7 electron volts to come through. We have an atmosphere that has an energy thing at 0.7 electron volts, allows it to come through. And we just so happen to have in our bodies these reorganization energies surrounding the electron transfer, which all of everything sort of couples into. And generally, if you look up what is the reorganization energy barrier there that we have to overcome, it's about 0.7 electron volts.
One thing that really stood out to me as you shared it was as we get to 40 years and beyond, you said 60-70% of mitochondria are affected. I want you to clarify what you meant there.
No, yeah.
Is it that we have less mitochondria or they're just not working as well? And then two, given what you're sharing here about IR light and other modalities for the mitochondria, give us some hope, if there is any, what we can do to make sure they're firing like they were when we were 30.
There are certain mitochondria in the eye, in the retina, that can drop by up to 60 to 70%. in terms of their energy output. I'm not saying that we have less mitochondria. We may. That factor that I was throwing out there was the amount of energy production that's coming out of the mitochondria. But certainly it's not. It's, in some places it's less, maybe 20 to 30%. The key is that this is a process that has already been connected to aging. And if we can reverse this process, we can potentially reverse some of the effects of aging and chronic disease. Again, there's studies out of Sweden, studies out of UK. People who spend more time outside in the sun live longer. I mean, people... That's clearly there's an association that's so strong, in fact, that Swedish women that were out in the sun the most and smoked had the same mortality as Swedish women that avoided the sun and didn't smoke. I mean, that's the type of effect that we're talking about here. It's a huge effect. But yeah, no, it's I don't know if that answers your question, but there's a lot there with infrared light, and the question is how do we actually get it? Again, now knowing what we've talked about with ultraviolet light, with visible light, with infrared light, the whole gamut, you can see why getting outside early in the morning before 9 o'clock is going to kill a number of birds with just 1 or 2 stones there, right? Number one, you're getting your daily dose of visible light to help your cortisol production. Number two, you're getting out into the sun when the sun is producing primarily infrared light and not a lot of ultraviolet light. So if you're fair-skinned and you don't want to get a lot of skin damage or over sun exposure, that's a perfect time to get outside, is in the morning time. So getting outside 15 minutes a day, every day before 9 o'clock. Look, I could have summed up our entire podcast simply by saying, hey guys, listen to me. Get outside before 9 o'clock, get sunlight for about 15 minutes, and do this every single day as much as you can. If you can't, get a sad lamp and sit in front of it for about 20 minutes before you go to work, and you're going to greatly improve your health in many different ways that you wouldn't even understand. Plus, getting outside is giving you fresh air. Getting outside means that you're probably going to exercise a little bit more anyway as well. I could have said that, and that would really be the actionable stuff to do with this podcast. But think about how much more diligence you're going to have doing that, knowing why it is actually having an improvement on your body.
To riff off of what you just said there, some of my high-level thoughts at the end of the conversation, specifically for somebody at a higher latitude, is vitamin D in the winter. We've talked about the UV light and how that could be a helper at that time. The SAD lamp, again, our short days right now. And then for the IR light, because it does penetrate through clothes, we can still get that throughout the winter. But a hack, if you can get them, is to get these incandescent bulbs, or even better yet, have those inside as well, and get some IR light that way.
Yeah, that's pretty much that's right on. And again, it seems as though based on the data that we're getting from Glenn Jeffrey's group, 60-watt bulb at your desk. I'll add this to one more thing that really sheds light onto what you're saying, Jesse. There was another study that was done very similar to Glenn Jeffrey's study where they had people sitting at their desk with a 60-watt incandescent bulb, except they did not use an incandescent bulb. They used a 850 monochromatic LED light source. So what did they find? They found that this light source did improve measures of depression. It did improve well-being, but it only did so when the study was conducted in the wintertime. It did not do so when the study was conducted in the summertime. And let me give you my suggestion as to why that's the case. It's because these people were probably getting outside after work and getting the benefits of sunlight in that situation. But when it was wintertime and they were not able to get that light, even this 850 monochromatic red light or infrared light was making up the difference. It was repairing the breach, if you will, that we were normally supposed to be getting infrared light. We weren't getting it, and it was working in the wintertime because we couldn't get it.
All right, my last thought before we part ways. In my mind, we've covered hacks for the different types of light and ways that we can get it if we can't get outside. Again, outside is always best. I don't want people to use these hacks and avoid going outside. Try and get outside when you can, but there are ways around it, thankfully. The one piece that you brought up with UV light was NO.
Yeah.
We talked about vitamin D being a hack there for the UV light, but anything we can do for NO through the winter up north, if we're not getting that light.
Yeah, that's a hard one to hack because nitric oxide has an extremely short half-life and you really can't supplement with it. Nitric oxide is synthesized from some amino acids like arginine, so you should probably make sure that you have plenty of that, but usually people are not very deficient in these essential amino acids. That one is that one's pretty much ultraviolet light. I would not recommend going into tanning beds with just ultraviolet light. There's a lot of hazards with that because of the effect of ultraviolet light by itself on the human body with mutations and skin cancer. So I would not recommend that. But I think, again, nitric oxide has definite benefits.
All right, Dr. Seheult, really love this conversation. Far-reaching, we went in depth, we covered the science, and then we stepped back to make it practical for people to understand. Really appreciate you. We're going to link up your YouTube channel, your social media, everything in the show notes. Thank you.
Thank you so much, Jesse.
Thank you for watching. Stick around here for this other great interview. You don't want to miss it. I'll see you over there.
In terms of the foundational approach to optimizing our circadian health and our circadian rhythm is make watching the sunrise an absolute priority. The combination of the morning coffee on the empty stomach, trying to do